Thanks. Ready to go. Well, thank you all for coming today. I think we were meeting just yesterday, and we may be meeting in another day or two, given the rapid pace of changes in our response to coronavirus. I'd like to make you a number of announcements today. As you probably have heard, I'm producing another executive order, modifying and strengthening the previous executive order and adding another number of additional points, which I'll get to. Other things that I'm doing as well is creating information and helpline immediately for the city of Plattsburgh. That's going to be 518-324 city, I believe, CITY. And I'll clarify that for you, the exact phone number. That will be forwarded to voicemail as well for 24/7 coverage, and any of your comments, concerns will be put in a database and then dealt with immediately. I know the public is getting very concerned about the level of services the city is providing. I'm also looking to put into place some assistance through an emergency response coordinator to be able to allow me to work as effectively as possible with all kinds of agencies outside the city and the various departments within the city. So expect more announcements for that. I'm sure there's individuals out in our community that are very happy to assist me in that matter. You saw the governor and the president both made statements this morning. The governor increased his mandatory participation order from private employers that are not considered essential service employers. If you recall, yesterday the standard was up from 50% to 75% should be trying to work at home or stay at home. He since then upped that to 100% for non-essential employees. Of course, the city is in the essential employee business. You probably saw the carve-outs for people who provide utilities, water, wastewater treatment, etc. And very many of the things that the city does are essential by nature and very often relate to the health and safety of our population. You saw me talk yesterday about strengthening the staffing for our police and our fire departments, putting on the second ambulance as well, and that's in place. If you think about even something as mundane as a taxi license is an essential service. If you're a taxi driver and needs to transport people from a nursing home to their doctor or the hospital, so we're really trying to figure out a way to, through distance delivered methods and relaxation of some of our code requirements, be able to continue to deliver all of our essential services. At the same time, there are things that we do more discretionary. For instance, things like leaf pickup, that can probably wait a little while. Large items for the people to dispose of can wait a little while, maybe even recycling. But refuse and waste management was also considered an essential service by the governor, and we will be maintaining those operations. What we will try to do, though, is work more in shifts. Try to work having our employees, our essential service employees, not working next to each other. Instead, having individual employees independently working. And to do that and be able to share the amount of equipment we have means we may need to put on additional shifts of smaller crews, multiple smaller crews rather than larger, less frequent crews. So we're working on that as well to enhance social distancing. I'm moving our standard for social distancing in all of our interactions up to 3 meters, 10 feet, rather than the previous standard of 2 meters, 6 feet. As you know, we tend to be a little bit ahead of standards adopted elsewhere, but we think that's the prudent thing to do. Our meeting rooms, if a meeting is absolutely necessary, we're confining the number of people in a meeting room to 10 people even in our largest rooms. Although, as you may have witnessed last night for our Common Council meeting, almost everybody attended virtually. I certainly respect the public's desire sometimes to publicly comment in person, but I was very grateful that the public chose to instead exercise their ability to be involved in democracy through distance-delivered methods, through YouTube chat, it's submission of their comments, etc., and that worked very well. Most all of our council attended from some other locations, and once we got the technical glitches out of the system, our Common Council meeting actually went very smoothly as a consequence. I'd like to highlight to you some of the changes in the executive order that was issued earlier this week. As you may know, we are modifying job duties to be able to move people around from those areas that, as a matter of current policy or priorities, we don't need as much. Instead, we need people in other areas. So we are moving people around consistent with their overall level of skills. As I alluded to a moment ago, we're inducing a timeshare system, so workers can share a piece of equipment or share spaces, but not all at the same time. So one individual may be asked to come and work on some of our fleet to keep our fleet active for a 4-hour period, and then that individual will vacate the shop space and some other individual will come in for another 4-hour period. So just like a timeshare for condos, we're trying to timeshare our jobs as well to make sure that workers, for the most part, aren't required to work next to one another. Fortunately, most of our workers actually can work on an individual basis and don't come directly into contact with the public. Those that do still have to come into contact with the public, for instance, to take care of some of their essential needs with regard to administration or paying their bills, etc. We're setting up drive-up or glass protected ways to do that, following some of the best advice that the Clinton County Board of Health is providing us with at this time. We also really implore and ask private employers to adopt similar practices, especially in the elaboration of social distancing. Please be sensitive to your neighbors and shut-ins. Plan a little bit ahead for yourself in shopping, but maybe shop for other people as well, as we mentioned last day. Food services, pharmacies, grocery stores, etc. are considered essential services, but we would like people to be able to space out their use of those essential services more over the 24-hour clock. So if we can get people to use the services in a less congested way, first of all, our employers may not need as many people at a given location at a given time. Could we stretch the number of employees and patrons over the 24-hour clock? I would be happy to go and shop at 1 in the morning if it made our community healthier. So I'm asking for voluntary cooperation in our community to try to extend the services with a lower volume of staff and customers, but spread over a greater amount of time so everybody's needs can be met. I really ask also for the cooperation of the public to allow us to deliver our essential services in ways that can be done that minimize face-to-face contact and from our employees working from home. And finally, I solicit the public's ideas on how to do this better. I'm very pleased with the number of emails and telephone calls we've been having with people who have good ideas on how we can do things better, how we can protect the community better, how we can take care of our most vulnerable population in the nursing homes and the extended care facilities better. And I very much appreciate all these ideas. As you know, and I know you've been following this very carefully, with every governor's press conference, he tells us we have another twice as many people now in the system and requiring care or receiving positive tests for coronavirus than we had the day before. So what we're really trying to do is recognize we're trying to manage that curve, manage that growth, and minimize the face-to-face contacts as much as possible. I applaud the governor for all his leadership in this way, and I hope that we're offering that similar sort of leadership for our region as well, being the only New York City within 100 miles. We have a certain responsibility in that way. And as you know, the President of the United States also extended some of his criteria and his best practices today as well. So I expect that list of things we all can do together to protect our community is going to be expanded by next day and the day after that and the day after that. So keep in touch and in tune, and we will consider or continue in the city to modify our best practices as the needs evolve. Happy to answer any questions.
As far as spreading out shopping times to minimize social interaction and having less people working in grocery stores at a time, spreading them out, have you had any conversations with grocery stores about that yet? And if so, what are you talking about, and is there a timeline on that?
We've been putting out guidance and recommendations all along our executive boards. I hope they're being listened to carefully. I do know those communities or those individuals are listening to the governor's directions very carefully as well. And any business who would like to seek our advice, we'd be very happy to sit down and meet with them. You know, this is going to be a big burden on small and medium-sized business in our community. I really hope that as we come up with economic packages from the federal government, it can really be tailored to those that are most hurt in this. I worry less about the very large businesses of the country. I worry much more about the small businesses. We need those small businesses to survive and be with us at the other end of what we think will be a relatively long ordeal.
Along those same lines, do you think that the expansion of time at stores would it leave them enough time to clean and restock the stores, or do you think they'd be kind of?
That's a very good point. And the governor's asked them to consider extended hours. I'm sure they're doing that very carefully, but you're right. As you know, within the city, we've got an accelerated, more frequent sanitizing regime to keep our buildings safe for you all to be able to come to these press conferences, for instance. Employers have to do the same sort of thing in the private sector as well. So that's a very well taken point.
And Governor Cuomo this morning advised residents to shelter in place. What is your reaction, and do you advise the same here in the city of Plattsburgh?
We do, absolutely, certainly. We're trying to do that with our employees as best we can too, by allowing our employees to deliver these essential services from their homes. We talked yesterday about creating 50 licenses for our most critical administrative employees to be able to do just that and work from home. It's actually working very well. There are times when they may need to actually come in and do a check run, et cetera, but if they do, we ask they do it one at a time. They're not occupying the same space at the same time. Keep the building as open as possible for them to get their work done. And they're also taking turns doing that. They can do that, come in, take care of their needs for an hour, go back home, and still maintain essential services without having any human contact as well. So I think you can maintain essential services and still have the spirit of not maintaining a human contact, the spirit of essentially sheltering in place is simultaneous. That's what we're trying to figure out the best way to do that.
You mentioned long-term impacts on local businesses. Any advice for how people can continue to support them when a lot of them are being told to close up or minimize their interactions with people?
The hospitality industry, as you know, is very important for the city of Plattsburgh, and our region is going to be very, very hard hit by this. Already has been for the last few weeks, but certainly it's going to be a long ordeal for them. I really hope that the federal government plays the largest role in commerce, and especially interstate commerce, can really lead in that way and make sure that any resources, we're now talking about $1 trillion bailouts for this economy to avoid the worst of a recession. I really hope that those resources need to be directed to those most harmed by all this. So as in a community for which the supply chain is very important, but also the visitor industry is very important, I think that we're certainly going to need an awful lot of attention in that way.
The governor's concerned about the number of hospital beds and ventilators that are available. So what concerns do you have as far as availability here in Plattsburgh?
That's exactly why we're doing all this, by lowering that rate of infection, by reducing your human contact. I think I was using the example yesterday from 30 contacts per day to 3. Well, and you're in a very difficult industry to actually be able to pull that off because you're in the human contact industry. But if we can get that 30 contacts per day to 1 or to 0, we can really lower the rate of infection. Governor Newsom of California estimated that by the end of May, 53.6%, if I recall, of his population will have been infected by the coronavirus. Many of them will not even know they were infected. Many of them who are infected and don't know they're infected will still be able to infect others. So we know that that's an inevitability. Our goal is to then manage that inevitability and keep people as healthy as possible, out of the hospital if possible, and those who need care, make sure the resources are available to them. So by lowering the infection rate and spreading it out over a much longer period of time, I'm not talking about a few days or a few weeks, we're really talking about a few months, a number of months. I would even go as far as to say for an indefinite period. We need to come up with practices that we can maintain on an indefinite period to ensure that we can deliver the services, the hospitals are not overwhelmed, but will be stretched for a very long period. If we can do that, we can manage those hospital resources. You're right. If this takes off here as it is in New York City, then clearly we're going to very quickly overrun the capacity of our healthcare providers to take care of those very critical needs in ICU through the number of ventilators, et cetera. So that's our whole goal here, is to delay and dampen this curve of infections that we're expecting. It's really all about the healthcare industry, all about creating an environment so the healthcare industry can function its very best.
Have you thought anything about like the summertime events, Mayor's Cup, anything like that, or is it still too far out?
It's a little too far out. I would not be at all surprised if they're impinged, but it's a little too far out to cancel anything. We are pretty confident that anything that the city expected to do with any of its partners in March and April is not, simply won't be feasible. Most all these are voluntary cancellations from the various groups that might have wanted to use the Crate Center, etc. We will certainly evaluate a few weeks out or a month or so out from our various events. I wouldn't be surprised if this these orders and this crisis continues through to July, and I wouldn't rule out some of the after effects of it continuing to on until September. One of the things we want to do is not produce a false remedy to this problem. What some communities are discovering is if they kind of artificially depress the rate of infection to lower that peak, it just causes a further secondary infection just a month or two later. So then you're going through infection, decline, kind of like that sine wave that you remember in high school. What we want to do is really manage this very broadly, but treat this thoroughly over the next number of months. So I wouldn't be surprised if that goes right into the fall. And the president said a similar thing in the past as well. No reason to panic though. It's really a management exercise, as kind of sterile as that sounds, and no pun intended, but this is really, we're trying to manage the crisis as best we can to keep as many people as healthy as we possibly can, to keep our healthcare providers with the maximum capacity to deal with this problem as best they can. And ultimately, in the process, what I think we're going to be doing is keeping a lot of people alive. And that's really the goal, keep people alive and healthy. That means a little bit of a sacrifice on us as individuals at times, maybe even for quite a while, but it's going to be well worth it when we realize that our community is going to be coming out of this much stronger at the end. Any further questions? Well, thank you very much. Keep in touch and stay healthy yourself. You all are on the front lines, and next time spread out a little bit more if you could. I know you have the camera angles and stuff. Thank you.
Thank you.
Probably by the time you get back to the station, all this is obsolete too, huh?
It never changes.
Yeah.
Worse than that, ever.
Yeah. Well, one good thing is you're probably covering the most significant story that you're going to cover in your entire career. So
I was talking about with Tom, so I said honestly, it's like, I'm scared. But B too, it's a moment in time I'm never gonna forget it. So it's kind of cool story.
I'm only 3 weeks into my career anyway, and I'm like,
You're doing great.
it's always like this, you're probably saying.
yeah.
Well, this is 60, I'm 60 years old now, and this is, I remember the Cold War and all that kind of stuff. This is the most significant things that ever happened in my life, and we're just getting started.
Well, that's what at the Essex County Press Conference 2 days ago, 3 days ago, that's what they were saying, is the next 45 days essentially, they said it's gonna be crazy, and it's just gonna get,
Yeah, it's supposed to be the worst.
The
in
worst.
45 days.
and then it can finally start trickling down.
Yeah, I think that that's probably a pretty good analysis. But even
Yeah.
if you think about it, it's going to really be peaking next 45 days, then the other side of the curve is
What do you need help
easily
with
another
here?
45 to 60 days longer.
That's why it's gonna be so long, yeah.
Yeah.
You want to carry.
It's easier, you must have known lighting was lighting, just to the left, right?
Stuff here.
Yeah, 'cause you changed rooms now.